Hey guys, welcome back to Clever Scrubs, and today we are going to talk about the procedure called cardiac catheterization, all right, or cardiac cath, and everything you need to know to help you be prepared. A cardiac catheterization is a medical procedure. It's used to look inside your heart and see if you have any heart problems. This procedure is performed in the hospital by a cardiologist with special training. Your cardiologist performing the procedure will let you know how to prepare for it, but you should not eat or drink the night before the procedure, and you should ask your doctor if you can continue taking some medications after midnight. And if you are taking blood thinners, it's very important for you to let your doctor know that you're on blood thinners, because he will probably ask you to stop taking these medications days before the procedure, as it increases the risk of bleeding during the procedure. Also let your doctor know if you're allergic to any medications or food. Now, the day of the procedure, you will come in to the hospital early in the morning and check in. Excuse me. A nurse will obtain your history and also give you consent papers for you to sign. After that, she'll review your labs. If not, then she'll do labs to assess your blood chemistry and coagulation, make sure that everything is okay. Once everything checks out, you will go into the procedure room. It's called the cath lab, where a team will prepare you and place you in a special table laying flat. There's gonna be like an x-ray machine over you, and this just helps to visualize your heart, and we will expose you to a small amount of radiation. Once you're ready, the team will introduce themselves and pretty much make sure you are the right patient and they're doing the right procedure on you. The good thing about this procedure is that you remain awakened throughout the whole procedure, okay? Now, the team usually consists of the doctor, an assistant, which is usually a nurse or a tech, and a circulating nurse outside the room to give you any medications that you might need, and there's a nurse outside the room who's monitoring your vitals and documenting everything during the procedure. Also, so don't worry, you're gonna be in good hands, okay? The procedure starts by the doctor inserting a long, thin, flexible catheter into your blood vessels. There's 3 access points, which include your arm, your groin, and your neck. He then advances the catheter into the area of the heart he wants to visualize. This test is pretty much called the coronary angiography, where he looks into arteries of your heart, and if there's any blockages, he can visualize those blockages. By injecting special dye through the catheter along with the x-ray, he can visualize the arteries, okay, of your heart. He can also look into your heart valves and chambers and see if there's any problems in those specific areas. After the procedure, you will remove the catheter and apply pressure to the insertion point for about 10 minutes. Once the pressure, once that's done, they'll apply like a pressure dressing on there. And if the groin was the insertion point, then you will need to lay flat for about 6 hours, and a nurse will keep monitoring the insertion point for any signs of bleeding. If your doctor fixes anything in your heart, he will let you know, and most likely you'll be admitted into the hospital for observation that day. If everything is normal, and you most likely will go home that day in the afternoon, but you have to make sure you have somebody to drive you home, okay? Before you leave the hospital, a couple things you want to make sure is that when you ask the doctor when you can resume regular activities again, you want to follow up with the doctor in his office and just know when to follow up in what couple weeks to follow up, and when to restart your home medications. Also know to contact the doctor or the nurse if the incision area starts bleeding or swelling, and if you feel any chills or fevers, or you start experiencing any numbness. Once again, thank you guys for watching, and remember that this channel is here to provide simple education, and you can support the channel by liking, sharing, or subscribing. I'll see you guys next time.